Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. And taking a looking at the numbers this morning, I should say that I can say that as of this morning, there were 97 total cases that have occurred in Foxboro since the beginning on March 15th. A total of 70 people have recovered. A total of 19 people are currently active with COVID-19, and 7 people have been lost in the follow-up. 559 people have tested negative, and 303 people are actually remain in the hospital with complications, and one person has died. So those numbers are stabilizing. Good to see that the numbers are not increasing at any significant rate. Also, I want to see what's happening on the state level, and we can see that from Norfolk County, we have 7,046 cases. A total of 663 people have died as a result of COVID-19, and right now the fatality rate is about 6.5%. That rate is up higher than it should be, but obviously, it is not unusual to see that kind of a rate at this point in time in the process, because this is later in the process, and people who do have complications eventually do pass at some point. So you will see that happen as part of this process. So we are currently at 7,046 cases in Norfolk County. 663 people have died. Middlesex County leads the way with 17,953. More than twice the amount of cases that we have in Norfolk County, and Suffolk County comes in second place in terms of total cases overall. A total of 17,800 beds are available for use throughout the Commonwealth. A total of 3,101 people are in those beds currently, and 794 cases are in ICU, which is mean that number has dropped below the number 800 now, which is actually a good sign that's trending clearly in the right direction. And now it appears that we are finally on the backside of this epidemic in terms of the impact here in Massachusetts. So let's take a look at what the report says this morning. And on that end, it starts out with, do you have any questions about COVID-19 testing sites in Massachusetts? And do you need a test to determine if you may have COVID-19? Give me 1 second. I want to try something a little different this morning. And we will try it this way. Okay. All right, so if you believe you may need a test, first contact your healthcare provider if he or she recommends that you should be tested, but their facility cannot offer the test. Obtain a referral or contract one of the facilities on the state's list. You may need to undergo an additional eligibility screen before you can be tested. If you have a clinician's referral, contact one of the sites from the list to make an appointment. These sites do not take walk-ins and require an appointment. List of sites can be found at mass.gov/mass-covid-19-testing-sites/download. DPH has created a poster on how to use face coverings effectively to share with local businesses. The poster will be translated in several languages and posted at the following link: mass.gov/info-details/COVID-19. During the governor's press conference on Tuesday, he stated that the best way for business to prepare while waiting for the reopening advisory board report due out on May 18th is to review the global workplace safety standards. Department of Public Health and COVID-19 Command Center developed new mandatory workplace safety standards in consultation with the reopening advisory board. These new standards will apply universally to all workplaces that are open in Phase 1 and are designed to reduce the risk of COVID-19 transmission to employees and customers during the first phase of the reopening, and are applicable to all sectors and industries. The administration is releasing these mandatory workplace safety standards early in advance of the start of Phase 1 to give workplaces time and to plan and prepare for the reopening effort. These safety standards will be supplemented by sector-specific safety protocols and recommended best practices, which provide further details and limited exceptions. Information can be found at mass.gov/info-details, reopening mandatory safety standards for workplaces, number sign related. And from the MRC email, As of May 12th, the coronavirus updates indicates that there are 79,332 confirmed positive cases of COVID-19 in the Commonwealth, with 870 new cases and 33 deaths as of yesterday at 4 p.m. Overall, 400,000 tests have been conducted by public and private sources. 13% of the 6,768 tests reported today were positive. 3,127 individuals are hospitalized with COVID-19 statewide, an increase of 25 from yesterday. The Department of Public Health has regularly released the data reporting dashboard. Hospital capacity as of May 12th, 54% of the Commonwealth's 17,800 permanent and temporary hospital beds are available for new patients. Personal protective equipment, PPE distribution continues across the Commonwealth, including 330,000 N95 and K95 masks and 136 ventilators. Mobile testing that continues to be done around the state with 640 visits and 38,485 tests. And the Massachusetts Health Connector has updated its informational resources for those seeking health insurance enrollment due to which circumstances related to the COVID-19 pandemic. As a reminder, the special enrollment period for health insurance is still open, but it closes on May 25th in case anybody's looking to be part of that. And let me see. For those who are unemployed and have experienced a significant work reduction and may not be certain if they qualify for standard unemployment assistance or are self-employed pandemic unemployment assistance, the Department of Unemployment Assistance has developed an easy-to-use, step-by-step screening tool so applicants can be certain they are applying to the correct system. Any individuals who still have not received their stimulus checks are strongly encouraged to visit the Get My Payment portal on the IRS website, which provides information on obtaining economic impact payments for those who did not receive a direct deposit tax return in 2019. As a reminder, anyone wishing to submit comments to the Reopening Advisory Board can do so online, and you can do so right on our website here in Foxboro. We do have access to that, and you can actually submit that information right here in Foxboro. The legislative update today, the governor filed a supplemental budget authorizing an additional $1 billion in COVID-specific spending for testing, equipment purchases, rate adjustments for essential human service workers, and other elements of pandemic response that are reimbursable by FEMA and other federal sources. This bill authorizes spending that is then reimbursed from federal sources, including the recently passed CARES Act. The Joint Committee on Education will be holding a virtual oversight hearing on the state of the remote learning and education impacts in the K-12 system due to COVID-19 impacts. This week's judicial court report on testing and confirmed positive cases at the Massachusetts jails and correctional facilities is available online. The American Red Cross has released a list of resources on teaching preparedness and safety while at home. These child-centered resources and activities for grades K through 5 allow for families to learn about emergency preparedness in a variety of online, family-friendly formats. The Department of Public Health also releases weekly reports on town-by-town COVID-19 case numbers and rates. We provide that information to you here, so you don't need to look there. If you want to, you certainly can throughout the day. Resources for residents experiencing job loss or loss of income. COVID-19 is causing broad disruption in the economy, which is affecting incomes of many residents and families. There are a number of state resources and supports available to support workers who may find themselves unemployed and otherwise incomes constrained during the uncertain time. Department of Unemployment Assistance, you can go to their website at www.mass.gov/orgs/Department of Unemployment Assistance. And under the pandemic EBT benefits for school children, the American Red Cross is asking for blood donations. There is a Department of Transitional Assistance Office support through the pandemic EBT benefits for school children. You can certainly go to that site too for further information. The American Red Cross is seeking blood donations. The need for which is significant due to blood drive cancellations. People can call 1-800-RED CROSS for more help on that front as well. The State of Home Advisory remains in place until May 18th. We expect to receive more guidance on Monday as far as our reopening guidance. We are working on our plans actively here in Foxboro, hoping to have a draft out by the end of this week. And a lot of pieces of information go into that process because we're looking at multiple sites and lots of information on what we should be doing. And of course, there is no standard approach here, but the state is coming up with new guidance, and even when we come up with our plan, we probably will have to amend it to a degree based upon what the state is going to provide us. But I think we want to get a jump and stay ahead of that process as much as we can. Just a couple other things that I wanted to announce to you today, and that is the fact that yesterday the House congressional Democrats filed a $3 trillion bill in Congress looking to provide, and $1 trillion of that would be for cities and towns, for aid to cities and towns across the United States. There seems to be little hope that will actually pass, but it was actually a first step in the process, the legislative process, in which things get filed, and then the process begins from there. The Senate will then begin discussions on that piece of it. The House Democrats have filed their bill. It hasn't even gone through Congress yet. It has just gone to, they just filed it yesterday, so there is an expectation that some discussion will occur on this on Friday, and then see where it goes from there. The Speaker of the House, Nancy Pelosi, has indicated that she hopes to pass something by the end of this week, and then send it along to the Senate where they can start debating on what they want to produce. Of course, the House is democratically controlled, whereas the Senate is Republican controlled. So obviously there'll be a difference of opinion between the two, and we'll see where it all comes out in the end. We'll have to wait and see. I am going to be on a conversation. I'm going to call later today with Senator Warren to see if, in fact, there's any guidance from her as to what we can expect here in Massachusetts, if anything. And so we are also looking for guidance from the state in terms of how they're going to help with our local finances. Tonight at 7 o'clock on cable TV, you'll be able to watch the discussion about where we are with our budget. We've made further trims in the budget, including additional trims that I'm making actually as of today, to not significant ones, but ones more to just revise the spending plan downward a little bit further in areas where we can do that. But you'll see, our sources and uses of free cash, our discussion about what we're expecting for revenues for next year, how we've made our decisions, even in light of the fact there is no guidance right now in terms of state aid from the Commonwealth. We will. I've been on the phone today, and we'll be on the phone again tomorrow with our state rep and state senator to see if I can get more further information and guidance on what we can expect on that level. So we're continuing to do everything we can to look at things locally and to stay focused on what we have to do to maintain services and to keep everybody updated on what's happening across the state and across the country and across the world, for that matter, and how this pandemic continues to impact us here, even locally here in Foxboro. We do anticipate that we will have a town meeting, and on June 15th. That's still our plan. We're expecting some guidance on Monday for how that will actually be able to work, and how many people will be able to attend, that type of thing, if there's going to be any limitations on that. Last night, the Board of Selectmen determined that they were going to stick with the high school location, even though there were a couple other options under consideration. One of them being possibly the middle school, possibly and also the craft organization generously offered the opportunity for us to possibly go into the field house, where there'd be plenty of opportunities to socially distance. But we think we can do that is equally as safely at the high school if we mark chairs accordingly and maintain a certain amount of distance between individuals. So we're going to continue to work through this process, and we'll do everything we can to keep everybody in a safe and healthy environment as much as we possibly can. Don't forget to vote. You can vote online, or actually you can vote by absentee ballot. If you go to the town's website, you get instructions as to how you can acquire an absentee ballot. And the election is still planned for June 8th at this point. So we're going to be working on more greater details on how all that continues to unfold. Town clerk's been focusing on that for the past several weeks, and has a plan for how he's been working on a plan on how he plans to make that work. So so those are the key things that we're working on right now. Anybody wants me to put something out for them through these broadcasts in the morning, you can send me something at www. You can send it to wkeegan@foxboroma.gov, and I'll be happy to put something out for you. So that is all I have for today. I will again be back with you tomorrow morning with further information about where we stand. Right now we have about 17 active cases. Actually 19 active cases here in Foxboro at this point in time, and that's a good sign. That number has come down a little bit, and also the number of people, hospitalizations statewide has come down. That's also good news. It's particularly in the areas of the ICU has dropped as well, so that's great to see that information come forward, and hopefully that trend continues in the right direction. Until then, I'll see you next time. Have a great day. Stay healthy. I'll talk to you soon. Thank you.